You know, after 20+ years of practice, I've had thousands of conversations with men, many of them in their 60s, 70s, and beyond, who've come to me with the same concern. They feel frustrated. They feel embarrassed. And frankly, they feel like their bodies have betrayed them. They're experiencing erectile dysfunction, or what we in medicine call ED. And here's what I want you to know right off the bat. You're not alone. In fact, more than half of men over 50 experience some degree of erectile dysfunction. And the even better news? Much of it is reversible, not through invasive procedures, not through expensive medications alone, but through simple, proven lifestyle changes that you can start implementing today. In this video, I'm going to share with you 6 evidence-based strategies that can help you regain your sexual health and, more importantly, your confidence. We're talking about real solutions backed by clinical research, the kind of science I've seen change men's lives. Before we dive in, if you find this information valuable, please like, subscribe, and share this with anyone who might benefit. Your support means the world to me, and it helps me create more content dedicated to your health. So, let's get started. Part 1. The foundation. What's really happening? Before we talk about solutions, I want you to understand why this happens. Because knowledge is power, and understanding the root cause gives you the tools to fix it. Erectile dysfunction isn't really about the penis. I know that sounds strange, but hear me out. When you think about an erection, you're probably imagining something mechanical, something that just happens. But in reality, an erection is a vascular event. It's all about blood flow. Here's how it works. When you become sexually aroused, your brain sends a signal to your arteries. These arteries then relax and open up. When they do, blood rushes into the erectile tissue of the penis, and boom, you have an erection. It stays firm as long as the blood is trapped inside. Now, the key players in this whole process are, first, the blood vessels themselves. They need to be healthy and flexible. But as we age, and especially if we have conditions like high blood pressure, high cholesterol, or diabetes, these vessels become stiff and narrow. They can't relax properly. And when the vessels can't open up, the blood can't flow where it needs to go. Second, a chemical called nitric oxide, or nitrogen monoxide for short. This is like the key that tells your blood vessels to relax and open. If your body isn't producing enough nitric oxide, or if it's being destroyed too quickly, your vessels won't relax. And without that relaxation, there's no erection. Third, your overall cardiovascular health. Here's something that might surprise you. Erectile dysfunction is often one of the first warning signs of cardiovascular disease. In fact, men who experience ED are at higher risk for heart attacks and strokes. This is why we take ED seriously. It's not just about sexual function, it's about your overall health. Now, what damages these systems? Let me list them. Smoking narrows blood vessels and depletes nitric oxide. High blood pressure damages the lining of arteries. Diabetes both damages vessels and interferes with nerve function. Obesity increases inflammation throughout your body. A sedentary lifestyle, your cardiovascular system becomes deconditioned. Excess alcohol impairs nerve function and damages blood vessels. Poor sleep disrupts hormone production, especially testosterone. Chronic stress and anxiety triggers a sympathetic nervous system response that actually prevents erections. The beautiful part? Most of these are modifiable. You can change them, and when you do, your erectile function often improves dramatically. In fact, research shows that men who make comprehensive lifestyle changes see improvement rates of 40 to 50% or more. Some men recover full function. Others see significant improvement, all without medication. So let's talk about those 6 simple things you can start doing today. Part 2. The 6 solutions. The 6 strategies I'm about to share with you are not complicated, they're not expensive, and they're not new. What makes them powerful is that they're evidence-based, meaning real doctors at real medical institutions have studied them. They've measured the results, and the results are consistent. These strategies are: 1. Cardiovascular exercise, the most powerful tool. 2. Dietary changes, specifically foods that boost blood flow. 3. Weight management, if you need it. 4. Better sleep, more important than you think. 5. Stress reduction and managing anxiety, because psychology matters. 6. Reducing or eliminating harmful substances, smoking and excess alcohol. Now, here's what's important. You don't need to do all of these perfectly. Start with 1 or 2. Build momentum. Then add the others. Small, consistent changes lead to big results. Let's dive into each one. Strategy number 1, cardiovascular exercise. Let's start with exercise. Specifically, cardiovascular exercise. This is the single most powerful intervention for erectile dysfunction, and I mean that. If you do nothing else on this list, doing this one thing can make a tremendous difference. Here's why. Remember when we talked about nitric oxide, the chemical that tells your blood vessels to relax? Well, cardiovascular exercise is like a factory for nitric oxide production. When you engage in aerobic activity, your heart pumps harder, blood flows faster through your arteries, and in response, your body produces more nitric oxide. Over time, your endothelial function, the health of your blood vessel lining, improves. What does the research show? One landmark study published in JAMA followed men with erectile dysfunction. One group received medication alone. The other group received medication plus a structured exercise program. After just 3 months, the medication-only group saw improvement in 39% of men. The medication plus exercise group saw improvement in 78% of men, nearly double. And some of the exercise group eventually stopped needing the medication altogether. Another study looked at men who had suffered heart attacks. These are high-risk cardiovascular patients. When they participated in a simple walking program after discharge from the hospital, their erectile function improved within 1 month. 1 month. So what kind of exercise are we talking about? Optimal protocol. The research suggests that 40 minutes of moderate intensity aerobic exercise 4 times per week for 6 months shows the best results. But let me translate that for you, because I don't want you to think you need to run marathons. Moderate intensity means you're working hard enough that you can talk, but not sing. Your heart rate should be around 60 to 75% of your maximum heart rate. A simple way to calculate this: take 220 minus your age. Multiply by 0.65. That's your target zone. For a 65-year-old man, that would be 22 065155. 155 times 0.65 equals about 100 beats per minute. You can achieve this with brisk walking, 4 to 5 miles per hour on flat ground, cycling, stationary or outdoor, swimming or water aerobics, dancing, rowing, elliptical machine, jogging if your knees allow it. The key is that it elevates your heart rate and you do it consistently. Start where you are. If you haven't exercised in years, don't jump into 40 minutes right away. Start with 15 to 20 minutes 3 times a week, then gradually increase. Your body adapts, and so does your sexual function. Can you combine with other exercise? Absolutely. In fact, the research shows that when you combine aerobic exercise with resistance training, you see even better results, up to 15% additional improvement in erectile function. What does that mean? Spend 30 minutes on cardio. Then do 10 to 15 minutes of light resistance training. Think body weight exercises, light dumbbells, or resistance bands. This helps maintain muscle mass, improves overall strength, and boosts testosterone, all of which support sexual health. How long until you see results? Most men report noticeable improvements within 4 to 6 weeks of consistent exercise. Major improvements typically show by 3 months, and these benefits compound over time. Here's the thing. Exercise doesn't just help your erections. It reduces your risk of heart disease. It helps control blood pressure and blood sugar. It improves mood. It increases energy. It helps you sleep better. In other words, it's like a miracle drug, except it's free, and it actually works. A word of caution, though. If you have existing heart disease or you're over 65 and haven't exercised regularly, please check with your doctor before starting an exercise program. A simple stress test can clear you and give you peace of mind. Strategy number 2, nutrition and foods for blood flow. Now, let's talk about food, because what you eat directly affects your erectile function. Think of your diet as building blocks. You're either building healthy blood vessels or you're building disease. There's not much middle ground. The general principle is this: anything that's good for your heart is good for your penis. That's because healthy erections require healthy arteries. And the Mediterranean diet, which has been studied extensively for heart health, also happens to be fantastic for erectile function. What makes a food good for, Ed? Foods that improve blood flow, boost nitric oxide production, provide antioxidants to protect blood vessels, support testosterone production, reduce inflammation, support healthy cholesterol levels. Let me give you the specific foods to focus on. Hash 1. Leafy greens, especially spinach. Popeye wasn't wrong. Spinach is loaded with folate, also called folic acid. Studies show that men with low folate levels are more likely to have ED. A cup of boiled spinach gives you about 66% of your daily folate needs. But here's what folate does. It helps your body produce and recycle nitric oxide. Remember, that's the chemical that opens up your blood vessels. Spinach also contains magnesium, which relaxes smooth muscle and blood vessel walls. This allows blood to flow more easily. How to use it? Add spinach to omelets, smoothies, salads, pasta dishes. The heat actually increases the bioavailability of certain nutrients, so cooked spinach is fine, too. Hash 2. Tomatoes, the lycopene powerhouse. Tomatoes are red because of a compound called lycopene, and lycopene is powerful for blood vessel health. A 2024 study found that men who consumed less lycopene had a higher risk of erectile dysfunction. Lycopene is an antioxidant that protects your blood vessels from damage. It also boosts nitric oxide production. Here's something interesting. Tomato juice has been studied specifically. Men who drank tomato juice for 12 weeks showed improvements in erectile function. Some showed improvements in semen quality and sperm motility. And interestingly, the more processed the tomato product, the more available the lycopene. So tomato paste, tomato sauce, and tomato juice are actually better than fresh tomatoes in this regard. How to use it. Add tomato sauce to whole grain pasta. Drink a glass of tomato juice. Add tomatoes to your salads and sandwiches. #3. Watermelon, nature's Viagra. I know this sounds almost too simple, but watermelon actually has science behind it. Watermelon is rich in an amino acid called citrulline. Your body converts citrulline into arginine, which then gets converted into nitric oxide. So you're looking at a chain. Watermelon gives citrulline, gives arginine, gives nitric oxide, gives vasodilation, gives better erections. And unlike medications, there are no side effects. It's watermelon. How to use it. Eat it as a snack. Add it to smoothies. The seeds are also beneficial, so don't feel like you need to avoid them. #4. Fatty fish, salmon, mackerel, trout. These fish are rich in omega-3 fatty acids. Omega-3 salts are anti-inflammatory and support heart health. Fish also provides protein, which supports muscle maintenance and testosterone production. A healthy cardiovascular system is essential for erectile function. How to use it. Aim for 2 to 3 servings of fatty fish per week. Bake, grill, or steam it. Avoid fried preparations. #5. Nuts and seeds, almonds, walnuts, pumpkin seeds. Let's break these down. Almonds and walnuts contain arginine, the same amino acid found in watermelon. They also contain healthy fats that support cardiovascular health. Pumpkin seeds are specifically rich in zinc. Zinc is crucial for testosterone production. And if you know anything about male sexual function, you know testosterone matters. Studies show that men with low zinc levels are more likely to have low testosterone and erectile dysfunction. Pumpkin seeds also contain magnesium and amino acids that support blood flow. How to use it. Snack on a handful daily. Add to salads. Sprinkle on oatmeal. Make a trail mix. #6. Oysters, the mineral powerhouse. Oysters have been considered an aphrodisiac for centuries, and there's actually science to it. Oysters are packed with zinc, more zinc per ounce than almost any other food. They're also rich in dopamine, which increases sexual desire. How to use it. If you enjoy them, eat them a few times a month. Don't force them if you don't like them. There are plenty of other zinc sources. 7. Dark chocolate, a sweet treat. Dark chocolate contains flavonoids, compounds that improve blood flow and support nitric oxide production. It's also mood-enhancing, which doesn't hurt when we're talking about sexual performance. How to use it. Enjoy a square or two of dark chocolate, 70% cacao or higher, a few times a week. Number 8. Berries, blueberries, strawberries, raspberries. These are packed with antioxidants that protect blood vessel health and reduce inflammation. Berries also support cardiovascular function, which, as we keep saying, is essential for erectile function. How to use it? Add to yogurt, smoothies, oatmeal. Eat as snacks. The overall dietary pattern. Now here's the important part. It's not just about individual foods. It's about the overall pattern. Research on plant-based diets and Mediterranean diets shows that men who eat more fruits, more vegetables, more whole grains, more nuts, and less processed food have significantly lower rates of erectile dysfunction. In one meta-analysis of 14 studies with nearly 27,000 participants, men who followed a plant-based diet had a 29% lower risk of ED. Men who followed a low-fat diet had a 73% lower risk. That's substantial. What about foods to avoid? High-fat, high-sugar diets. These damage blood vessel linings and increase inflammation. Processed foods, linked to ED. Trans fats, damage blood vessel health. Too much salt raises blood pressure, damages vessels. A practical tip: imagine your plate. Half of it should be vegetables and fruits. A quarter should be lean protein. A quarter should be whole grains or legumes. That's it. Simple. Strategy number 3. Weight management. Now let's talk about weight. And I want to preface this by saying I'm not here to shame anyone. This isn't about vanity. This is about health and function. But the reality is this: excess weight, particularly abdominal obesity, is one of the strongest predictors of erectile dysfunction. Why? There are several mechanisms. First, the inflammation factor. Excess fat tissue, especially around your midsection, is metabolically active. It produces inflammatory chemicals called cytokines. These cytokines damage your endothelial cells, the lining of your blood vessels. When your endothelium is damaged, your body can't produce adequate nitric oxide. And without nitric oxide, erections become difficult. Second, insulin resistance. Men who are overweight often develop insulin resistance. Their bodies don't respond properly to insulin. This damages blood vessels and impairs blood flow. Third, lower testosterone. Excess weight suppresses testosterone production. And testosterone is essential not just for sexual desire, but also for the physical mechanisms of erection. Fourth, mechanical factors. When you're carrying excess weight, especially abdominal weight, it can compress blood vessels and nerves that are important for sexual function. The research is clear. Studies show that men who lose just 5 to 10% of their body weight experience significant improvements in erectile function, sometimes as much as a 20 to 25% improvement. Men who lose more see even greater improvements. One study followed overweight men with ED. Those who lost an average of 10 kilograms, that's about 22 pounds, had a success rate of sexual intercourse that improved from 32% to 45%. That's substantial. Now, here's what's important. You don't need to reach your ideal weight. You don't need to be magazine cover ready. Modest weight loss leads to modest but meaningful improvements. Weight loss helps? 5% weight loss. Often noticeable improvements. 10% weight loss. Significant improvements for many men. 15 to 20% weight loss. Major improvements. sometimes reversal of AD entirely. The approach to weight loss that works best especially for men over 55, I don't recommend crash diets. They don't work long term and they can be dangerous. Instead, focus on 1. Caloric deficit, but a modest one. You don't need to cut 1,000 calories from your diet. A deficit of 300 to 500 calories per day is sustainable and leads to steady, consistent weight loss. That's roughly 1 to 2 pounds per week. 2. Protein intake. As we age, maintaining muscle becomes more important. Protein helps preserve muscle while you're losing fat. Aim for 25 to 30 grams of protein per meal. This could be a piece of fish, chicken, eggs, legumes, or dairy. 3. Fiber. Vegetables, fruits, and whole grains keep you full and support metabolic health. Most men should get 25 to 30 grams of fiber daily. If you're not eating that much now, increase gradually to avoid digestive discomfort. 4. Limit ultra-processed foods. I'm not saying you can never have a cookie or a piece of cake, but most of your diet, say 80 to 90%, should be whole foods, vegetables, fruits, lean proteins, whole grains, nuts, seeds. 5. Movement beyond formal exercise. This is something many people overlook. If you're sitting 10 hours a day and only exercising 40 minutes, that's a net negative. Try to move more throughout the day. Take the stairs. Park further away. Walk while on the phone. Do light gardening or housework. This incidental activity burns calories and improves metabolic health. The timeline for weight loss benefits? Unlike exercise, where you might see benefits in 4 to 6 weeks, weight loss improvements tend to be gradual. Most men see noticeable improvements after losing 10+ pounds. Give yourself at least 2 to 3 months of consistent effort before evaluating results. An important note: if you're on medications for blood pressure, diabetes, or cholesterol, weight loss can affect how your body metabolizes those medications. Work with your doctor. As you lose weight and your health improves, you may need dose adjustments. Bottom line, weight loss isn't a quick fix, but for men who need it, it's one of the most powerful interventions. And the benefits extend far beyond sexual function. Your knees will thank you. Your heart will thank you. Your overall quality of life will improve. Strategy number 4, sleep quality. Now I'm going to talk about something that many men overlook: sleep. You might be thinking, Dr. Smith, I came here to learn about erectile dysfunction, not sleep. But trust me, these are intimately connected. Here's why. Your body does critical repair and hormone production work during sleep. When you're not sleeping well, that work doesn't happen. And one of the hormones most affected is testosterone. The testosterone connection? Testosterone is produced during sleep, particularly during REM sleep, the stage where you're dreaming. Most of your daily testosterone production happens during sleep. When you're sleep-deprived, testosterone drops. And when testosterone drops, erectile function declines. A study published in the Journal of Sexual Medicine found that men who slept less than 5 hours per night had a significantly higher prevalence of erectile dysfunction compared to men who slept 7 to 8 hours. Another study followed men over a 10-year period. Those who consistently slept poorly had worse erectile function later in life. But it's not just about testosterone. Poor sleep also increases cortisol, your stress hormone. Elevated cortisol activates your sympathetic nervous system, which is the fight or flight response. And fight or flight is incompatible with erections. You need the rest and digest parasympathetic nervous system to be activated. Increases inflammation, which damages blood vessels, impairs endothelial function, reducing nitric oxide production, worsens insulin resistance, which damages vascular function, affects mood and anxiety. Poor sleep increases depression and anxiety, both of which contribute to ED. So in many ways, poor sleep is like a toxin for your erectile function. What does good sleep look like? The standard recommendation is 7 to 9 hours per night for adults. But for men over 55, some research suggests that 7 to 8 hours is optimal. Less than 6 hours is associated with sexual dysfunction. More than 9 hours is also associated with worse outcomes. It can indicate an underlying health problem. But here's the thing. It's not just about quantity. It's about quality. You can sleep 8 hours, but spend the whole night tossing and turning. That's not restorative sleep. How to improve sleep quality? 1. Consistency. Go to bed at the same time and wake at the same time, even on weekends. Your body loves rhythm. When you maintain a consistent sleep schedule, your circadian rhythm, your internal clock, regulates properly. 2. Cool, dark bedroom. Your body temperature naturally drops before sleep. A cool room supports this. Aim for around P-minus 68 degrees Fahrenheit, P-minus 20 degrees Celsius. Darkness triggers melatonin production. Use blackout curtains if necessary. 3. Limit screens before bed. The blue light from phones, tablets, and computers suppresses melatonin production. Stop using screens 30 to 60 minutes before bed. 4. Avoid caffeine after 2 p.m. Caffeine has a half-life about 5 to 6 hours. If you have caffeine at 3 p.m., half of it is still in your system at 8 to 9 p.m. For men who are sensitive to caffeine, this can seriously disrupt sleep. 5. Avoid large meals close to bedtime. Digestion interferes with sleep. Eat your last meal 2 to 3 hours before bed. 6. Limit alcohol. While alcohol might make you drowsy initially, it severely disrupts sleep quality. You'll wake up frequently. You'll have less REM sleep, the stage where testosterone is produced. Many men find that cutting alcohol dramatically improves sleep quality and morning erections. 7. Exercise, but not too close to bedtime. Regular exercise improves sleep quality. But intense exercise within 2 to 3 hours of bedtime can be stimulating. Exercise earlier in the day if possible. 8. Manage stress. Anxiety and worry keep you awake. We'll talk more about stress management in a moment, but techniques like deep breathing, meditation, or journaling before bed can help. 9. Consider magnesium. Magnesium naturally promotes relaxation and sleep. Many men are deficient. A magnesium glycinate supplement, 300 to 400 milligrams, taken an hour before bed, can improve sleep quality. Check with your doctor first, especially if you're on other medications. 10. Watch for sleep apnea. If you snore loudly, gasp for air while sleeping, or wake up unrefreshed despite 8 hours in bed, you might have sleep apnea. This is a serious condition that disrupts sleep quality and is associated with ED. If you suspect this, see your doctor. The impact on the fight or flight response. And when that system is activated, you cannot have an erection. So he fails again, and the anxiety gets worse. And the next time, it's even harder. This cycle can continue even after the original physical cause is addressed. That's why managing anxiety and stress is absolutely critical. The physiology of anxiety and erections. When you're anxious or stressed, your body releases adrenaline and cortisol. These hormones constrict blood vessels, the opposite of what you need, reduce blood flow to the penis, suppress testosterone production, activate the sympathetic nervous system, which literally prevents erections. Meanwhile, for an erection to occur, you need blood vessels to dilate, blood to flow to the penis. The parasympathetic nervous system to be activated, the rest and digest system. These two states are incompatible. Anxiety literally prevents erections. One study found that men with ED also had higher rates of anxiety disorders. But here's the important part. When they treated the anxiety through therapy, stress reduction, or sometimes medication, their erectile function often improved significantly. The specific stress reduction techniques that work. 1. Deep breathing exercises. This is simple but powerful. When you breathe slowly and deeply, you activate your parasympathetic nervous system. This is the system that promotes relaxation and erections. Here's a technique called box breathing. Breathe in slowly for a count of 4. Hold for a count of 4. Breathe out slowly for a count of 4. Hold for a count of 4. Repeat for 5 to 10 minutes. Do this daily, especially before bed. And if you find yourself anxious at any point during the day, do this breathing exercise. It's calming, and it works. 2. Meditation and mindfulness. Even 10 minutes of daily meditation can reduce stress and anxiety significantly. There are apps like Headspace and Calm that guide you through meditations. Many men find that regular meditation not only reduces anxiety, but also improves sexual performance by keeping them present and engaged. 3. Progressive muscle relaxation. This is a technique where you systematically tense and then relax each muscle group in your body. It reduces physical tension and trains your body to recognize and release stress. A typical session takes about 20 minutes. 4. Regular exercise. We talked about exercise for its cardiovascular benefits, but it's also incredibly powerful for anxiety. Exercise releases endorphins, natural mood-elevating chemicals. Men who exercise regularly report lower anxiety and better sexual function. 5. Talk therapy or counseling. Sometimes anxiety about sexual performance is so severe that it requires professional help. There's no shame in this. Cognitive behavioral therapy, CBT, is specifically effective for performance anxiety and has strong evidence. A therapist can help you work through negative thought patterns and develop coping strategies. 6. Limit stressors where possible. This isn't always realistic. You can't eliminate work stress or family issues, but you can control some things. Limit news consumption. Set boundaries at work if possible. Delegate where you can. 7. Adequate social connection. Men who feel isolated are more anxious and depressed. Spending time with friends and family, engaging in hobbies, and maintaining social connections all reduce stress. 8. Consider adaptogenic herbs. Some herbs like ashwagandha and rhodiola have evidence for reducing stress and anxiety. Ashwagandha, in particular, has been studied for its effects on stress and sexual function. A typical dose is 300 to 600 milligrams daily. Again, check with your doctor first. The reframing that helps? Here's something important. Performance anxiety often comes from putting too much pressure on yourself. The expectation that every sexual encounter must result in a perfect erection is unrealistic. Here's what I tell my patients. Sexual function exists on a spectrum. Sometimes it's perfect. Sometimes it's very good. Sometimes it's just adequate. That's normal for all men at all ages. It doesn't mean you're broken. It means you're human. When you remove the pressure, when you tell yourself, it's okay if tonight isn't perfect. Sex is about connection and intimacy, not about a perfect erection. You'll often find that your erections actually improve because you've removed the anxiety. So part of stress management is also managing your expectations and being kinder to yourself. The timeline? Many men see improvements in anxiety-related ED within days or weeks of implementing stress reduction techniques. The deep breathing and meditation can have immediate effects. And as you practice these over weeks and months, the improvements compound. Your mind and your penis are connected. Manage your stress, reduce your anxiety, and your sexual function will almost certainly improve. Strategy number 6, avoiding harmful substances. All right, we're on our final strategy, and this one is straightforward. Stop doing things that harm your erectile function. Specifically, I'm talking about smoking and excessive alcohol. Smoking is perhaps the most damaging thing you can do to your blood vessels and your erectile function. Here's what smoking does. Narrows blood vessels. Nicotine causes vasoconstriction, meaning your arteries get tighter. This reduces blood flow everywhere in your body, including your penis. Damages endothelial cells, the lining of your blood vessels. When these cells are damaged, they can't produce adequate nitric oxide. Increases inflammation throughout your entire cardiovascular system. Reduces oxygen in the blood, which impairs erectile function. The research is dramatic. Men who smoke have a significantly higher risk of erectile dysfunction. Some studies show that smokers are up to 2 to 3 times more likely to experience EE than non-smokers. And here's the good news. When men quit smoking, their erectile function often improves. One study followed men who had quit smoking. Within 2 to 4 weeks of quitting, erectile function began to improve. The improvement continued over 3 to 6 months as their blood vessels healed. If you smoke and you're experiencing AD, quitting smoking might be the single most impactful thing you can do. I know it's not easy. Nicotine is highly addictive, but your sexual function and your overall health depends on it. Talk to your doctor about smoking cessation strategies. Prescription medications like varenicline, Chantix, nicotine replacement therapy counseling, or apps designed to help you quit. Excessive alcohol. Now, alcohol is a bit more nuanced than smoking. A moderate amount of alcohol, say 1 to 2 drinks per day, is not inherently harmful to erectile function. In fact, some research suggests that moderate alcohol consumption might be associated with better sexual function, but excessive alcohol is very harmful. Here's what happens. Impairs nerve function. Alcohol is a depressant. It dampens nerve signals throughout your body, including the nerves involved in sexual arousal and erection. Decreases testosterone. Heavy alcohol consumption lowers testosterone production. Disrupts sleep, which, as we discussed, affects testosterone and sexual function. Damages blood vessels. Chronic heavy drinking damages your endothelium and increases your risk of cardiovascular disease. Causes depression and anxiety, both of which contribute to ED. Liver damage. Chronic heavy drinking damages the liver, which plays a crucial role in metabolizing hormones. How much is excessive? The standard definition is more than 2 drinks per day for men, or more than 14 drinks per week. What's a drink? 12 ounces of beer, 5% alcohol, 5 ounces of wine, 12% alcohol, 1.5 ounces of liquor, 40% alcohol. If you're drinking heavily, cutting back or quitting entirely can significantly improve erectile function. Many men report improvements within weeks of reducing alcohol consumption. A practical note. If you're a heavy drinker, don't quit cold turkey without medical supervision. Alcohol withdrawal can be serious. Talk to your doctor about a safe way to reduce or eliminate alcohol consumption. The bottom line on harmful substances. You've made all these changes. You're exercising. You're eating well. You're losing weight. You're sleeping better. You're managing stress. But if you're still smoking heavily or drinking excessively, you're sabotaging all that work. It's like trying to fill a bathtub with the drain open. Remove the harmful substances and all the other strategies work better. All right, so we've covered 6 evidence-based strategies for reversing erectile dysfunction. 1. Cardiovascular exercise, the most powerful tool. 2. Nutrition foods that boost blood flow. 3. Weight management, if you need it. 4. Sleep quality, for hormone production and stress reduction. 5. Stress management, to break the anxiety cycle. 6. Avoiding harmful substances, removing the obstacles. Now, here's what I want you to know. You don't need to do all of these perfectly. Start with 1 or 2. Build momentum. Then add the others. If you choose just cardiovascular exercise and improve your sleep, you might see significant improvements. If you add nutrition changes, you'll likely see even more. The key is consistency. Small, consistent actions lead to big results. And here's the most important thing. These strategies aren't just about your penis. They're about your overall health. A man who exercises regularly, eats well, maintains a healthy weight, sleeps well, and manages stress doesn't just have better erectile function. He has more energy, he feels better, he's healthier, he lives longer. So you're not doing this just for sexual function. You're investing in your overall quality of life. If you found this information valuable, if it's given you hope that you can improve your sexual health, please like, subscribe, and share this video with anyone who might benefit. Your support means everything to me. And remember, erectile dysfunction is not a life sentence. It's not something you have to accept. For most men, it's a reversible condition. And with these 6 strategies, you have the tools to do something about it. I'll see you in the next video. Take care of yourself. I love you, friends.